I think initially, they were slow in taking action on epidemic prevention. That caused the epidemic outbreak. Their sense of crisis was not that strong. Taiwan had experienced the SARS outbreak, so we had a sense of vigilance. I think in the beginning, they should have encouraged people to wear face masks and wash their hands frequently. Wearing a face mask is self-protection and to keep from spreading the virus to other people. So they should have started with the basics. I think they should first do a good job of educating the public, then raise the capacity of the medical system. That's because the virus is transmitted from human to human. If you don't do a good job on the small steps, it will be spread very quickly, and the epidemic will become more serious. I'm not that worried about them spreading the disease to Taiwan, because Taiwan has done a pretty good job of epidemic prevention. We know how to protect ourselves. I'm confident they can overcome the virus because they will learn from other countries, including Taiwan. So I think it will gradually get better.
Compared to Asian countries, the West was not as active in dealing with the virus. They waited until the situation was very serious before dealing with it, when it had already seriously spread to the communities. Perhaps it's because at first they didn't think it was that important, and only began dealing with the problem later when it was serious. My suggestion to them is wear face masks, wash their hands frequently, and be aware of the need to disinfect. They should also put alcohol sanitizers and thermometers in public places, such as mass transit stations. I hope they understand the seriousness of the situation and will be active in dealing with the virus and not affect Asia. I do have confidence in them, but I hope they'll be more active. With time, it will be resolved.
The biggest difference between how Taiwan and Western countries handled it is that Taiwan took steps even before the epidemic became serious. In this respect, I think Taiwan's government did a great job. But actually, good epidemic prevention isn't just up to the government. The people also have to cooperate. On that, I think Western and Asian countries are different. Western societies tend to value freedom, so their attitude toward this epidemic has been rather liberal, rather soft, rather free. Compared to Taiwan, you can see there's a big difference in policy, strategy, and methods. Controlling and preventing the epidemic requires all countries joining hands. If it's just Asian countries taking measures, it's not enough because the virus disregards borders. So I think Western countries should adopt a very serious attitude in dealing with this. What's good is we heard in the news that Western countries are now adopting very serious measures. I heard New York will lock down the city. Of course, if they had done it earlier, it would have been much better. It's a little late, but there's still time. As long as you're willing to do this, it's much better than not doing it.